mentions mental health, self-harm, and suicide. Please view at your own discretion. This video is meant for educational purposes only and should not be used to self-diagnose. Please consult your healthcare provider for a definitive diagnosis if you feel you are experiencing any symptoms mentioned in this video. Meet Sam. Sam's loved ones are concerned for his well-being since they have noticed changes in his personality and mood for some time now. He's been doing things that are out of character for him. He's more impulsive and has been turning to alcohol and adapting bad eating habits. His interests and values also change often. His friends and family encourage Sam to seek out care for his well-being. He builds up the confidence to talk about it with his family healthcare provider, who then refers him to a psychiatrist. When talking to the psychiatrist, Sam shares that he's been having trouble sleeping at night. On top of his impulsive behaviors, Sam has also been experiencing mood swings. At times, he feels very energetic, active, happy, confident, and talks a lot more than usual. But at other times, he feels very sad and worthless, has passing thoughts of self-harm, has trouble concentrating, and just doesn't have the energy or interest to do anything. Initially, he didn't think that anything was up, but started realizing these changes in his mood and behavior after his friends and family pointed them out. He also mentioned that he has some childhood trauma and has grown up in an unstable household. Potentially due to this, mixed with work and other life events, Sam has been feeling very stressed lately, which may play a role in why he's been feeling more depressed and experiencing mood swings. Sometimes, he has trouble carrying on with his day-to-day activities, but is still able to complete his tasks no problem at other times. Even though mood changes are a common human behavior in response to both negative and positive events, Sam seems to be experiencing consistent mood swings that are affecting his behavior and functioning. The psychiatrist assesses Sam's symptoms using the Diagnostic and Statistical Manual of Mental Disorders 5th edition, or DSM-5, which is a guidebook listing all the criteria that need to be met by a patient to diagnose them with a mental disorder. They diagnose Sam with bipolar disorder, or BD. BD is a mental illness that causes changes in a person's mood, energy, and activity levels. It is characterized by recurring manic or hypomanic episodes that can be interchanged with depressive episodes as well. Manic episodes are times when someone feels very elevated emotions, such as feeling very energized, irritable, confident, and active. Hypomanic episodes are just less severe manic episodes. Depressive episodes are on the opposite side of the scale, where someone could feel very sad, anxious, restless, indifferent, hopeless, and having difficulty with focus. There are 3 types of bipolar disorder. Bipolar 1 disorder is when there are manic episodes that last all day, every day, for at least 7 days, with depressive episodes mixed in. Bipolar 2 disorder is when there's a random pattern of depressive and hypomanic episodes. And finally, cyclothymic disorder is when someone has less severe depressive and hypomanic symptoms that aren't intense enough to be episodes. Sam's symptoms are more in line with bipolar 2 disorder. BD is typically treated with a combination of prescription drugs and psychotherapy. Mood stabilizers and atypical antipsychotics such as lithium and valproate are prescribed medications that can prevent mood episodes and minimize its severity. Drugs to treat the individual symptoms, like sleep medication, could also be prescribed. Depressive episodes could be treated with antidepressants coupled with mood stabilizers as well. Psychotherapy is just a fancy word for talk therapy. This is when patients talk with a mental health provider to learn more about and better understand their emotions, thoughts, and behaviors in hopes of implementing change. Cognitive behavioral therapy is a type of psychotherapy known to help with depression and insomnia. This is a beneficial option for BD patients. Months go by, and Sam doesn't feel like there's been any improvements in himself. While discussing this with his healthcare team, new information comes to light. Sam has been having trouble navigating relationships and doesn't feel like he fits in. When asked further about this, Sam opens up about his past more, and we learn that he has a fear of abandonment which stems from his childhood. Growing up in an unstable household with not much attention from his parents, he always felt like he wasn't worthy of love. When he gets into arguments with a loved one, he often feels very triggered. He feels a range of emotions from intense, inappropriate bouts of anger to feelings of emptiness, hopelessness, and thoughts of self-harm when the argument has subsided. He finds that he might have a favorite person who he holds a strong relationship with for a while, and then the same person might be someone he has a strong dislike towards when his needs aren't being met. He also has a tendency to push people away in fear of getting hurt. These experiences take an immense toll on his self-esteem, and he feels like everyone close to him is walking on eggshells around him. Based on his initial concerns and the information presented now, the psychiatrist changes his diagnosis from bipolar disorder to borderline personality disorder, or BPD. BPD is a mental illness concerning the inability to regulate emotions, which often leads to a poor self-esteem, dysfunctional relationships, and impulsive decisions. Symptoms of this mental illness does not apply to everyone who is diagnosed with BPD, but some of the most common ones include extreme and intense mood swings that can last a few hours to a few days, pattern of short-lived relationships, quick changing interests and values, engaging in impulsive or dangerous behaviors such as substance abuse, self-harm, suicidal thoughts and threats, poor anger management, feelings of emptiness and hopelessness, and feelings of dissociation. People who are at a higher risk of developing BPD are those with exposure to traumatic events, a family member who is diagnosed with BPD, and even brain structure and the way it functions plays a role in the development of the illness. Treatment relies heavily on psychotherapy to help those with BPD navigate healthy relationships with others and themselves. There are many different forms of psychotherapy that depend on the type of concerns being presented. For example, dialectical behavior therapy, DBT, focuses on mindfulness to help control bouts of intense emotion and manage stress, whereas mentalization-based therapy, MBT, focuses on understanding what others are feeling. Self-care activities such as exercise are also encouraged to help with mood swings, impulsivity, and anger management. Medications are often not used in the treatment of BPD, but are used when there are co-occurring conditions such as anxiety and depression. In order to understand how BPD and BD are different, it is important to understand that BPD is a personality disorder. According to the DSM-5, there are 3 clusters of personality disorders, and within the 3 are different kinds of personality disorders that share similar character traits. Some of those disorders include schizoid personality disorder, which is a cluster A personality disorder. Antisocial personality disorder is a cluster B condition, and obsessive-compulsive disorder is a cluster C disorder. BPD is a cluster B condition that is characterized by emotional and impulsive behaviors and have a difficult time maintaining relationships. Personality disorders have an impact on the way you feel, behave, and your self-image. Bipolar disorder, on the other hand, is a mood disorder. Mood disorders encompass distorted and inconsistent emotions that interfere with your ability to function. Other mood disorders include major depressive disorder, psychothymic disorder, and seasonal affective disorder. All these disorders are characterized by the reduction of your ability to function in your daily life and society. Mood disorders have overly erratic and inconsistent changes in your mood. Symptoms of BPD that mostly differ from BD are fear of abandonment, unstable relationships, fear of emptiness, sudden and short mood shifts. And symptoms of BD that mostly differ from BPD are sleep disturbance, distinct euphoric and depressive periods of time, and sustained mood shifts. When it comes to diagnosing BPD and bipolar disorder, in order to avoid misdiagnosis, your healthcare professional will ask questions directly or through a questionnaire of some sort in order to get an understanding of your symptoms and the duration and severity of those symptoms. Your family medical history will be taken into account, especially for bipolar disorder, as it is the most likely psychiatric disorder to be passed down from family. Your history of trauma and childhood is something that could be discussed. There's a strong link between adverse childhood experiences, such as emotional, physical, or sexual abuse, and personality disorders. Duration of certain symptoms will be taken into account, since BPD and BD have mania and depressive symptoms, but differ in their longevity and severity. Your relationships with others in your life will be taken into account to understand the impact your mental condition has on people around you and your relationships with them. After months of counseling and commitment from Sam's end, he starts to notice positive changes in himself and is finding it easier to cope with his anger and impulsivity. His family and friends have also noticed these changes as well. He still has long ways to go, but he is content with how things are going. With the right support system and healthcare team, Sam is able to learn better coping mechanisms and function better in life.